my name's Amy and I'm a PR consultant here in Dubai. I chose Dr. Khan because I'd heard such great things about him. He also did a little bit of Botox for me 6 months ago and I loved it, so when I was looking to do something a little bit more, he was a natural choice. The results I'm looking for today are a really refreshed look, so to just smooth out the fine lines, to make me feel more confident, and to get me ready for the event season.
So with these lines that you have around the forehead, you've just got a really dynamic face, so it moves a lot. Also, you can see when you smile, you can scrunch up your nose a little bit. You can see that there are dynamic lines on the nose as well, what we call bunny lines. So oftentimes when we treat the eyes, the bunny lines get a little worse. So that normally then we would go and treat them beforehand, just so that we can avoid that. Small amount of volume that can be used here. What it'll do is get rid of the dark circles and also make you look like you've had a good night's sleep. So that's something we can do. And finally, I'm looking at the overall, because really the importance is the balance in the face. If you look at your chin, a little bit of lengthening of the chin, you see, would make your face more triangular and longer. Yep. And would match better your nasal profile, particularly because we're going to do the lips and bring those out. So to bring this in conjunction would, I think, look more harmonious would be the word. Okay, so we're going to start with one of the treatments and then we'll work it from there. So my product of choice for the under eye area is a product called Volbella. It's made by Juvederm. It's not the thickest filler, it's actually quite light. If that's a kind of common term, so that doesn't attract a lot of water to itself and it gives a nice smooth contour. Face art is actually an analysis and a treatment of facial contours to improve the harmony in the face, and we employ Botox and fillers for this, and we also then finish with a cryosurgical treatment. She doesn't need a whole lot because her eyes were not that, but I'm sure, let her see the difference. We'll have a look. Yeah.
Oh, wow. Yeah,
you see? So basically you just look fresher, that's all. I mean, because you don't have that depression. If you lift up like that, you can see more clearly. These lips now. So the way I like to do the lips is have a look at the contours, a little bit weak, but not terribly because she's still young. So the first step will be to put a tiny bit just into contour, tiny, literally like 0.05, and you can see that contour is improved a little bit. We don't want to make it too sharp, and as I said, I don't want to go too far down there because otherwise her lips will look too large. Now you see you get a little bit more definition in the border. I'm going to do the same over here. Then as we inject, you can see how things are beginning to fill, and again it's going to be tiny amounts. Now you can see how this lip is bigger than the other side of the lip. You get the elevation here. The vermilion is rolling out compared to the other side. Of course there will be bleeding and oozing which we have to manage, but on the whole we can see now the differences quite clearly. So now we're going to do the same on the other side. A little bit of an injection here. Again, withdraw. And you can see now that side increasing as well. She doesn't need much on her lower. I'm only putting a tiny bit in. In fact, give me Volbella. Because I'm only looking for shine. I'm not really looking for anything else. So the lower lip here, just a little touch. That's it. So really it's only about putting a little bit in. You can see it moving in on my plunger, but not making a massive difference to the lip, except just giving it a little bit of shine. And that's all we want. Okay. So have a look at the lower lip. I mean, you'll see, only thing you'll see is a texture change. So now for Amy, we're going to do a little chin enhancement. We're going to do that with some Restylane. It's one of the products I like to use for the chin. We're ready to start? Okay, so we're going to start. You will feel just a little bit and some pressure now. So I put one here, one here, one here, one here, one here, to just give the chin projection equally. I mean, a lot of this really is the eye. You have to have the eye watching all the time for symmetry. And that's it. And you can see that little bubble now coming out here. So this is the things that we have to make sure we correct. If we massage them down, they will disappear. And then we need to assess it from both angles, from the side and from the top. All right, my dear, lift up. So here we go along the jawline now, which I think is a really important part of the procedure. Let's see that lifting up there. We blend it in. We come along here. Same procedure. Again, you see it raising, and the nice thing about Restylane, you can just massage it straight in. The contours become quite smooth as long as you don't get any severe bumps. That is the important thing. Patients will always tell you they feel something later, that they might feel a little bit lumpy. But as long as you can't see it and the effect is there, that's the important thing.
I'm here for my 2-week consult with Dr. Khan. We did face art where he did some filler on my lips, on my lower jaw and underneath my eyes, and then some Botox around my forehead. I'm really happy with the results so far. It's very natural, so people haven't necessarily commented but have said that I don't look as tired, which is perfect. The only thing that maybe I might like to talk to him about is the little bunny lines, which potentially having a little bit of Botox in that area to stop them moving.